The clavicle is essentially a strut that connects your chest to your shoulder. Occasionally, the clavicle can be broken or fractured when an individual suffers a traumatic injury or a fall on the shoulder. If the two ends of the bone are completely displaced or not connected, it does oftentimes require fixation or reconstruction. For clavicle fractures, these tend to be more of acute injuries and surgery can be somewhat urgent. Once the surgery is scheduled, the pre-admission testing department will tend to reach out to patients quickly to discuss their procedure and answer any questions.
We contact the patient to schedule a phone interview with one of our nurses. The interview takes about 20 minutes depending on the extent of the patient's medical history. We ask a series of questions, and then we set up any pre-admission testing that needs to be done.
Before the surgery, our job is to give patients the adequate and appropriate amount of information to understand exactly what's going to happen that day. So the pre-admission testing team is an excellent support staff that we are fortunate to have at Northwestern.
The patient is called the night before to be notified what time their surgery is and what time they need to arrive at the hospital.
A patient having clavicle surgery will wear something loose, preferably button up, to put on easily after surgery.
On the day of the surgery, the patient checks in at the front counter and meets the staff there.
The patient will be seen by the surgeon who will be performing the surgery.
We'll discuss the procedure, as well as confirm that the informed consent form that the patient will sign matches with the correct extremity. After this, the anesthesiologist will discuss choices and options for anesthesia.
Every patient that comes in for surgery will ultimately meet a physician anesthesiologist who will ask a series of questions regarding your medical history, then ultimately create an anesthetic plan that's tailored to you, bearing in mind what your medical conditions are and your prior anesthetic experiences.
In the operating room, usually there are 3 or 4 people. First, there's the anesthesiologist. Second, there's myself and oftentimes my physician assistant. There will be a scrub nurse whose job is to pass instruments to myself and my physician assistant during the operation. Clavicle fracture surgery entails taking the 2 ends of the bone, putting them together and holding them with a plate and screws. We do these through as small incision as possible on the top of the clavicle. Afterwards, the incision is closed with minimally invasive techniques, oftentimes with a nylon suture. Patients wake up in the operating room. A lot of times because of the anesthetic, they won't remember that. But a patient is transported from the surgical suite to the recovery room, at which time a surgical postoperative nurse will take care of them.
Patients can expect to go home 1 to 2 hours after surgery. After clavicle surgery, patients may remove their dressing after 2 days. They should apply a Band-Aid or dressing over the incision to keep it dry until they are seen at their first post-op appointment. Shoulder patients will be restricted to one arm after surgery for a while, so may need help with chores and food preparation immediately after surgery.
It's important to get things set up at home. It's important to have family members help if possible. Thinking about these things before the operation will typically make the surgical experience a lot better.
After clavicle surgery, patients are allowed to drive once they are off of pain medication and feel safe. They are required to remove their sling and rest their arm comfortably at their side.
For the first month, patients will do their own exercises at home, flexing, extending their elbow, doing some gentle pendulum exercises with their shoulder, and then at about 5 weeks, we'll start outpatient physical therapy.
The goal for the clavicle procedure for physical therapy is to try to get that range of motion back, but more importantly, trying to get it to be relatively pain-free. Then we move on to working more on posture so that shoulder doesn't round forward, and then working into strengthening to return to prior level of functioning.
Typically, the clavicle heals somewhere between week 8 or week 12 postoperatively, and once the bone is healed, the patient can return to their normal functionality. Thankfully, we have a lot of great clinicians at Northwestern, and I feel passionate about working here. We are on the cutting edge and the forefront of orthoscopic and joint replacement surgery at Northwestern. When you come to Northwestern, you should feel comfortable in the fact that you're receiving the most innovative, cutting-edge procedure that is available.